Mark and this is Straight Talk. With me today is Professor Ben Cowling from the Hong Kong University, epidemiologist. Now, Professor Cowling, this virus has mutated. How worried should we be?
Viruses change all the time, usually just a little bit at a time. The new strain that we've just detected in the UK seems to have changed a little bit more. And whereas a few months ago it was just found on rare occasions, in the last month it was 60% of all the detections in the UK. So it does seem to have something special about it. Maybe it can spread just that little bit better than the other strains from before.
This is 70% more contagious.
Yeah, that was one estimate, is that it's much more contagious. I'm not sure. It must be a little bit more contagious because it's grown to be the predominant strain in the UK. And I suspect it's going to be found in quite a number of other countries as well.
Even here, right?
I think in Hong Kong, we've been doing very well with the travel quarantine. So I don't think the virus, that particular strain, would have got into Hong Kong yet. But it has been picked up in travellers from the UK. Let's hope not. Let's hope not. Because it would be that much more difficult to control if it did come in.
How worried should we be?
That's worrying because we're already struggling to stay on top of transmission. And if we get a strain coming in that's even more transmissible to start with, then that means we have to fight even harder to stop it from spreading, to slow down the spread. And we're already struggling as it is to bring the numbers down.
Now, if it can change, mutate to become more contagious, why cannot it change to become less contagious?
Well, it's quite possible that the virus has been changing in that way as well, but those less contagious mutations wouldn't be able to spread because they're less contagious. So those variants will disappear, and the more contagious variants will be more successful in spreading and will come to predominate. So it's a worrying sign, and this could happen again in the future. We could have new strains which are even more contagious, or maybe can escape the immunity from people that have already been infected in the past. That's something that we would expect from viruses in the longer term, hopefully not this year.
So can it be like SARS? It burns itself out?
SARS didn't really burn itself out. We got rid of SARS. It was eliminated by human actions. So SARS was different to COVID. For SARS, almost all the infections were very severe, easy to recognize in patients and in medical doctors, medical staff particularly, in Hong Kong and in other parts of the world. And so once we were able to identify who was infected, isolate them and prevent them from spreading, we were able to bring the numbers down to zero.
But we're doing that now.
Yeah, we're doing it, and we're bringing the numbers down, but it's more difficult because so many COVID infections are mild. They're in the community, they're not recognized, they transmit onwards, and it's very difficult to keep up with the virus.
How about compulsory testing for everyone? I mean, CY Leung, the former CE, suggested it. Others have suggested it. Even some of the state-controlled newspapers have suggested it. Yeah. Do you agree with that?
It's an option. So when we think
You mean for everybody?
When we think about how to respond to COVID, there's a playbook. So there's a list of things which we could do. And that's things like school closures, working at home, closing
We're
bars.
doing some of that now.
Right, we have all these lists of different things we could do. So mass testing is one of the options, but it's very, very expensive and it's very difficult logistically to implement. In mainland China, they're very successful in locking down entire cities and then doing mass testing exercises. It's enormously expensive and difficult, but they've been able to do it because of their infrastructure that the government has available. In Hong Kong, we don't have the same infrastructure. I think it would be more difficult here than it has been in the mainland. It's still an option, and if things were to get out of control here, I think the government might seriously consider it. But so far, we've managed with the other measures in the playbook. We haven't needed to turn to that.
I'm surprised you say it is an option, though, Professor, because you've got 7.5 million people in Hong Kong, and many of them, well, not many, a lot, live in subdivided homes. How do you shut down the entire city for 2 to 3 weeks? They'll go crazy.
No, I agree with you. I think it's very difficult. That's why I think the government wouldn't choose to do it. In mainland China, it's a different context. They have been successful in using that approach. In Hong Kong, I feel like it wouldn't be the first choice or the second choice or the third choice. Maybe more as an act of last resort. If the numbers keep going up and up and up, then we have no choice but to really ask everybody to stay at home for a week or two to get the numbers back down under control. I think the hospitals in the fourth wave have really been under a lot of pressure, particularly the intensive care units. And that's just with 100 or so cases a day for a period of time. If the numbers go 200, 300, 500 cases a day, that's really going to pose serious problems for the healthcare system. And if that was to happen, let's say in the future, in the coming few months, then I think the government might think about mass testing. But right now, I don't think it's a good option.
So your last resort means if hundreds get infected every single day.
Yeah, so I think the hospitals were approaching breaking point. They didn't reach breaking point, but they were approaching breaking point with the fourth wave, with a period of time with 100 cases a day. If we were to see larger numbers than that for a prolonged period of time, I think we'd need...
How long is a long period of time?
I think we had 100 cases a day for 2 or 3 weeks, I think. So more than that, more cases
and larger
accumulating.
numbers, more
and larger
people.
numbers accumulating. So maybe a bigger spike or a longer period of time with lots of cases.
Now, the people who want compulsory testing for everybody says, we need to bring cases down to 0. Is that doable?
It's a good objective. We managed that between the second wave and the third wave, and very briefly between the third and the fourth wave. If we can get to 0 and stay at 0 consistently, like some other places have been able to do, like New Zealand for quite a period of time,
yeah,
like
Taiwan, yeah.
Then we can go back to normal. Life can go back to normal. We just keep a very tight control over people coming into Hong Kong with the 21-day now quarantine. It was 14 days before, and be very, very careful about the loopholes, because I think the loopholes were the reasons why the second wave, the third wave, and the fourth wave
What are
started.
the loopholes?
So the air crew don't need to comply with 14-day quarantine or 21-day quarantine. Maritime workers don't need to comply. And there's other special exemptions, VIPs as well, I think. So
Why would VIPs be exempt?
Oh, because they're VIPs.
Yeah, but I mean, doesn't mean they won't catch the virus.
No, that's right. So I think that may have been a problem in some places. I think in Hong Kong, it could pose a problem in the coming few months, that we have very, very strict requirements for the majority of people, and then a minority have these exemptions and loopholes.
Do you think there should be no exemptions whatsoever?
It's difficult in practice. It's difficult in practice to have no
why?
exemptions. Well, for aircrew, if you have a rule that every aircrew coming into Hong Kong has to then stay in quarantine for 14 days or 21 days, I think airlines wouldn't fly. They'll just...
No, why can't they just come into Hong Kong, go straight to their hotel, and then don't go out, and then leave when they have to?
So that's the current rule, but it's not monitored strictly, and there's always a risk that those aircrew might not follow the rules. And that's what happened in Taiwan to trigger the recent local outbreak, that a pilot, I think, didn't follow those exact rules.
Right. Now, the thing is, some people say that the fourth wave is the most serious. It is, obviously. Why is that so? It's worse than the first few waves.
So the measures that the government's brought in have been very similar in the third wave and the fourth wave.
It's even tougher.
Yeah, a little bit tougher, that's right. But I think the behaviors of people in response to those measures hasn't been as strict. Maybe people are getting tired of the social distancing, so you still see a lot of crowds about. People have had a lot of family gatherings, whereas in the third wave, they didn't. And I think all of those things have contributed.
And we had Christmas, and we had the winter solstice.
So I don't think the numbers are going to come down in the fourth wave just yet. I think they'll
When will it come down?
Hopefully by Chinese New Year. If we can get to 0 by Chinese New Year, that would be great. Because I think at Chinese New Year, there's a potential for another surge as people mix with all their relatives and friends again.
You think it'll happen?
I hope so. I really hope we can get down. It's going to get easier when the numbers come down more and more, because we can then count on the contact tracing and the quarantine to pull its weight again. When the numbers are high, it's difficult because the manpower maybe isn't there for all the contact tracing and the quarantine. We've heard about people having to wait to get into quarantine. And so when the numbers come down, it's easier for that team to do their job.
Why is it that so many cases are untraceable now?
That's difficult. So I don't think they're truly untraceable. I think they haven't been traced, and that's the manpower issue, the resources issue, that maybe when there's 100-something cases a day, it's just not possible to investigate every single one to see where they might have got infected, who they might have passed infection on to. And that's why we've seen the numbers of people going to quarantine hasn't been as high as it was in the past, because not so many contacts have been traced.
Now, give me a straight answer on this, Professor. Some of the critics who want mass testing for everybody say the government has been doing a bad job in dealing with this issue. A lot of people believe that. Do you think so? It's been doing a bad job?
The government's done okay. They've done what they can do. They've got the playbook, and they've used tools from the playbook which are appropriate in Hong Kong. We've kept the numbers to a reasonable level. We have seen a lot of infections, but there could have been a lot more if the government hadn't acted. We also rely on people's behaviors. The people of Hong Kong are very savvy. They know what they need to do. And that was really made a massive difference in the first, second, third wave, and now in the fourth wave. I think people are getting a little bit tired of the social distancing, but we've got to push, because if we get the numbers down to zero, have a period of calm as the vaccinations are coming in, then we'll see a return back to normal, hopefully next summer.
So you're blaming the people rather than the government?
Not exactly. I think the government's got to find ways to encourage people to change their behaviours, to stay at home more, to comply with social distancing. But it's difficult for the government. I mean, I recognise it's been a long time of having all of these measures. There's not many more things the government could do. It's really up to the people now.
It's up to the people, but some people say that it's also up to the government. They've always been reactive rather than doing things ahead of time, proactive.
Yeah, in the second wave, the third wave, the fourth wave, measures were brought in. I thought they could have been brought in a little bit sooner, a week sooner maybe. For the fourth wave, that would have made a bit of a difference if the bars had been shut a little bit earlier, karaoke parlours, other places where we knew there was a risk of transmission, gyms as well. But there's a lot of resistance to bringing in those measures when case numbers seem low. The problem in reality is that the numbers today are not the infections today. So you have to act now, because you haven't even seen what's going to come a week later or 2 weeks later. Infections have already occurred, and they're going to appear as cases in a week or two's time. So if you delay acting, then there's going to be even more and more cases.
Okay. Quick break. See you soon. Don't go away. Thanks for staying with us. This is Straight Talk. With me is Professor Ben Cowling from the Hong Kong University. Now, Professor Cowling, when this thing first started and the nurses had to go on strike to force the government to close the borders, right? And then people were still coming in from the mainland, and Carrie Lam said, they're Hong Kong residents. We cannot stop them from coming in, right? They're Hong Kong residents, right? That was the reason she gave for not closing all the borders and allowing lots of people coming back to Hong Kong people living on the mainland. Now, she's changed her tune. Hong Kong people in the UK cannot come back. They're Hong Kong people. They're Hong Kong residents. Is that right?
It's South Africa as well now, I believe. So I don't know the legal details. I don't know where those people are supposed to go if they're in the UK and their visas are
They can't come back.
If they can't come back, where are they supposed to go? Because if their visa's running out in the UK, they're stuck.
Exactly right.
So
I heard somebody in the radio this morning saying that, the visa is running out. She needs to come back to Hong Kong to renew it, but she can't do that.
So I don't know if it's a sustainable solution. Right now, we have got to try really hard to prevent the new strain from coming in, but I don't think it's only going to be in the UK. I think it's going to be in many other places. So we've got to have a decision to make. But anyway, I don't think the 14-day quarantine was really an issue. It was actually working very well. It's worked well in Hong Kong for the last 6 months.
But now we've got 21 days.
Now it's 21 days. It's worked well in Taiwan and New Zealand. 14 days was fine. 21 days is even better. It will be even more secure to stop the virus from getting in, but we've still got all these loopholes. So I don't know if the entry ban for people from particular countries is necessary. For Hong Kong residents from particular countries, maybe we'll see an end to that soon. But I think the quarantine is useful, because if we can stop the virus from getting in, that saves us all the work of cleaning up after it does get in and causes outbreaks. So if we can get the numbers down to zero, and if we can keep it out with the even stricter quarantine now.
There are a lot of many ifs in there.
Oh, sure. Well, we managed, between the second wave and the third wave, we had quite a long period of calm with the 14-day quarantine that was keeping the virus out. Between the third wave and the fourth wave, not so long. But after the fourth wave is over, hopefully we can have that period of calm again, to have a time to go back to normal. Hopefully there wouldn't even be a fifth wave before we've got good vaccine coverage.
Again, when will the fourth wave be over?
Yeah, hopefully by Chinese New Year. I really hope we'll be down to zero by
But then when Chinese New Year comes along, people gather again, and then there'll be another wave.
Well, hopefully it will be down to zero, so there wouldn't be virus in the community to transmit and to spread. But you're right, if there's still infections in the community, then I would expect a surge around Chinese New Year because of that.
You think it will be zero by Chinese New Year?
I hope so. I hope that when the numbers are coming down, we can get them to come down faster, because the contact tracing is going to be more efficient, the quarantine is going to be more efficient. The targeted measures are going to work better with smaller numbers.
Now, the vaccine, everybody's talking about the vaccine now, right? I mean, they started doing it in the US, they started doing it in Europe, and some other places are doing it. When will it come to Hong Kong? When can we expect to see vaccines available? Carrie Lam says perhaps early January. We were supposed to get the China-made one, but then the data has not yet been published. So the Pfizer one will come here first, right? The BioNTech one, right?
Let's see. So for the Chinese vaccine, I think it's ready to come, but they need to get their results published and get them out, and then get the approval in Hong Kong, go through the approvals process, and then we can start using that vaccine here. I think there'll be people that want to take it, and I know the government's ordered a lot of that vaccine. And then we'll have the Pfizer, I think, by March. I think something like 1 million doses to start with, and then hopefully 1 million every month.
I thought the Pfizer one will be coming in January.
I don't know. Let's see. I don't know. I haven't heard the arrival date. If it comes in January, that's brilliant. The sooner that we can start vaccinating, the sooner that we can get a high level of vaccine coverage, which is what we need to get back to normal.
How long will it take to vaccinate 7.5 million people?
I think even if we were able to get millions and millions of vials of vaccine into Hong Kong now, it would take a long time to vaccinate everybody because the process...
And then you're done.
You've got to line everyone up. You've got to make sure you don't vaccinate the wrong people at the wrong time, or you've got to have a space of time between two doses. It's a big operation. Maybe they'll use the same infrastructure as they used for the mass testing back in September with the sports halls and community centres. And then you have an appointment, you go, you get vaccinated, and it's true, it's just a jab in the arm, but then you need to wait for 15 minutes for them to make sure you're okay, you don't have any immediate reaction. So that's a lot of people coming through every day. So I don't think we can vaccinate more than maybe 1 million a month. So that means it's going to take months and months and months to get coverage up to 5 million, 6 million, 7 million people.
How many people need to be vaccinated before we have herd immunity?
It's a difficult question. So actually there's two scenarios which I could try and explain. The first scenario, the vaccine does everything that we hope it's doing, hope it's going to do. It's going to protect everybody who gets vaccinated. If that's the case, then probably 5 million people vaccinated in Hong Kong would be enough to get herd immunity. And at that point, definitely everything could go back to normal. The second possibility, though, is if the vaccine protects against severe disease, which is what we've heard the reports, 90% for Pfizer, the others as well. That's great. But if it doesn't protect against you getting infected and being able to pass on infection, it's not ideal, because that means even if we vaccinate 5 million people, those 5 million could still get infection, maybe mild, but still be able to pass it on to the other 2 million people who haven't been vaccinated. So we don't exactly have herd immunity. We can avert the worst of COVID because so many people are protected against severe disease, but it's not quite the same. So if that is the scenario which plays out, we're going to aim to vaccinate everybody, because otherwise there's always going to be a risk that some people get severe.
So you're saying that even if you get vaccinated, you're protected, but you could still spread it to somebody else?
That's a possibility that we're worried about. That it's difficult to tell right now from the trials that have been reported, but it's a possibility. It does happen with some other vaccines. And anyway, the vaccine's only 90%. So even if you get vaccinated, if you get exposed, you've got 90% less chance to be infected, but you still might be infected. So that means that, for example, we couldn't say that anyone who's vaccinated can come into Hong Kong, because there's still a chance they could have COVID. It's only 90% effective. That's great, but it's not 100%.
If you've got it already, are you immune?
I think what we've seen so far from reports of reinfection events is that reinfections can occur. They're not so common. People are likely to have some degree of immunity in general. Maybe it's like the vaccine, 90%. But there's always going to be a possibility that you could be infected again a second time. Because it's a new virus, I think some people's immune system maybe wouldn't have a very strong reaction to the first infection, and maybe the second time you get infected, you'd have a stronger immunity after that. For the vaccine, we're giving 2 doses. I think that's part of the reason that the first dose gives you a good bit of immunity, but the second dose really brings it up to a high level of protection.
How much will you be immune if you have just 1 dose?
It's not clear. From the trials that we've seen so far, for that period of time between the first dose and the second dose, there does seem to be reasonable immunity, but it's not clear whether it lasts in the long term. So it's really advisable to get both doses. It may be the first dose gives you a good protection, but only for a short time, and then that protection disappears. You need the second boost, maybe a month later, so that you can have a longer term immunity for 6 months, a year, 2 years, 3 years, 4 years, 5 years.
Now, we were expecting the China-made vaccine to be here first, but now they haven't published the data yet. Why not?
I don't know. I don't know what happened with the study in Brazil.
Every week they were saying they will have the data, but it still hasn't happened yet.
So Brazil haven't reported. They've got a study in Indonesia. There was a media report the other day saying that it's got very high effectiveness in Indonesia. Let's see when they actually come out with the numbers. And I think there was a third study as well somewhere else. So maybe they're waiting to put everything together. But I don't understand why they didn't report it.
They're doing some trials in Brazil as well, right?
Yeah, Brazil was the first one that hasn't been reported. So I don't know why it hasn't been reported.
You think something could have gone wrong?
Well, they said it was at least 50% effective. That's good news. That means it works. And in Indonesia, the report was very high.
50% compared to 95% for the Pfizer one.
Yeah, so I think that's why people are keen to find out what exactly the number is. Because if it's high, then that's really good news.
Now, the thing is, this is a question that many people ask, a question of choice. Carrie Lam at first said, you won't have a choice. Now, she has said that depending on which vaccine comes first, then that automatically gives you a choice. Now, you've got quite a few vaccines out there, right? Given a choice, which one would you use?
It's a difficult question. I'm not one of the first. I'm not a high-risk person. I'm not elderly. I'm not a healthcare worker. So I'll have to wait my turn. But I'd be okay with getting any of the vaccines I've heard about so far. I think we don't know so much about the long-term effectiveness. We've heard about the short-term effectiveness, like 95% for Pfizer versus 70% for Oxford University vaccine from AstraZeneca, which we're going to get in Hong Kong as well. It's not clear what the long-term protection would be. It's quite possible that the Oxford vaccine starts a little bit lower, but maybe the protection continues for even longer. And for Sinovac as well, let's wait and see what the numbers are. But I'd be okay with whichever vaccine I can get.
Some people say they won't take the China one for whatever reason, and Carrie Lam says don't politicize it. So you're saying that if the China one comes first, you don't mind taking that?
Sure, but I shouldn't be the first in the queue because I'm not the high risk.
So that's avoiding the question. If it's available, will you take it?
I'll consider it. I think let's see the numbers first because I'd like to know what the effectiveness is of the Chinese vaccine. Until then, I don't have a decision to make. But I'm not worried about the safety of the China vaccine. I think that'll be fine. My concern is about the effectiveness. I think we should be using the most effective vaccines we can because it's going to make a big difference if we can vaccinate everybody with a 90 or 95% effective vaccine versus if we use a 70% or 60% effective vaccine.
But some doctors told me they won't take the China one. Other doctors say they won't take any of them because it's not been proven yet.
Yeah, we're not the first place in the world to use these vaccines. In the US and some European countries, they're going to have used millions of doses of these vaccines before we get a chance to use them in Hong Kong. So we'll know if there are any concerns with these vaccines by the time we have the chance to take them in Hong Kong. So I'm not worried about that right now. There's going to be so much experience with these vaccines, and they're so heavily monitored as well that I think we'll discover if there are any issues with any of the vaccines.
So you don't think life will return to normal until like late in the year, the new year?
Yeah, I think in Hong Kong, we're going to wait until Hong Kong's fully vaccinated or as close as we can get to fully vaccinated before we risk going back to normal, because otherwise we could have a surge in COVID cases, which again puts the hospital under pressure and have a lot of infections, a lot of severe cases, and even a lot of mortality. So whether or not other countries are fully vaccinated or not, I don't think Hong Kong's going to open up until the summer.
I've got to end the show. Happy New Year. See you next time. Good evening. Happy New Year to you.